So welcome back to part two to our sickle cell disease awareness video with Dr. Tamia Austin and Charlotte Walker. So a question that I wanted to ask you about was, can you tell us about the organization that you're currently working for and how it's bringing light to this issue?
So I started working with the As One Foundation in March of 2010. At the time, the mission was to unlock and unleash the full potential of young people while encouraging them to achieve their dreams in the face of life challenges. That mission eventually became to educate and increase awareness of sickle cell trait while encouraging young people to achieve their dream in the face of life's challenges. And that life challenge thing is directly related to the fact that Devard lost his brother, his identical twin, at Florida State back in 2001, February 26, 2001 to be exact. During those infamous mat drills, Devard and Devon, the entire team had to complete 64 drills. They had completed 63, and Devon was on the very last one. With sickle cell trait, they were exerted, but somehow Devon became overexerted, but he was also one of those athletes that was never going to quit. He was going to go through that wall. He was going to force his body to comply even when it was telling him you need to stop. And then to add insult to injury, he's coached up to be told your body is amazing. You'll pass out before you die. And Devon passed out once. Team was carrying him through the drill because if one man fails, the whole team fails, has to start over. He passed out again. The team is, still carrying him through, and he passed out again and died. And this was a tragedy in every sense of the word. This is Devon and Devard, best friends, identical twins, each other's confidant in life. They had shared dreams that Devard was now here faced with pursuing alone. He lost his brother, but he also lost the ability to play football at their dream school because Florida State would not take on the liability of letting him play football there. So he ended up at Washington State, where he played for 2 years, broke a lot of records, and was eventually drafted into the National Football League. And upon going to the Baltimore Ravens, he started what would be named the As One Foundation, and that is out of the story of their birth, their mom, their doctors being born in the Bahamas. They did not know they were twins until Devon followed Devard out of the birthing canal. The entire pregnancy, they had been hearing two hearts beating as one. So when Devon died, Devard would cope by doodling two hearts beating as one. He would just doodle it, just on pieces of paper, and eventually got a design that looked like two hearts with chains wrapped around it, beating as one. And he would have that tattooed on his arm, and that would eventually become the name of the foundation. And in 2012, I actually wrote a program called Operation Hydration. That is simply a sickle cell trait education program that educates about exertion, hydration, and elevation, and the precautions that are needed to be taken by young people that have sickle cell trait. Like I said before, it is not a death sentence. You can play. 7 to 18% of professional athletes have sickle cell trait. And they are Geno Atkins, there's Tevin Coleman, Willie Cauley-Stein, Ryan Clark, even though he had to discontinue playing because of the elevation in Denver, they still are able to play. So that is pretty much our mission now at the As One Foundation. And we go any and everywhere and try to educate as many parents, students, high school on up to college, and even pro athletes about the importance of educating yourself about sickle cell trait, knowing your status, and being properly hydrated.
Definitely
That's so
agree.
awesome.
It's so awesome that you're
It's
such a good advocate for sickle cell. What would you like individuals to take away from this discussion today about sickle cell?
The number one thing is to know your status. It is as important to me as anything else. Knowing whether you're HIV positive, knowing that you're practicing safe sex, it is important to know your sickle cell trait status. And it's a you can there's a not so sensitive, sometimes inaccurate, but it's a much affordable test. A lot of local sickle cell organizations offer the test free of charge. We do at the As One Foundation. It's a finger prick, and you can know your status in 6 minutes.
Oh, wow.
There's some slight unreliability in it, but you can follow up with your own doctor. You can go to any lab, like LabCorp or Quest Diagnostics, or just have your doctor draw your blood. And the more sensitive test is hemoglobin electrophoresis test that can not only tell you your sickle cell trait status, but it can tell you the percentage of abnormal hemoglobin in your blood, and you can also request to be tested for the full panel of beta thalassemia, alpha thalassemia. I'm just asking for you to know your status. If, by golly, if there's anybody that has sickle cell trait or disease in your family, if you've heard anything like that, go and get tested. I mean, there's countless parents that have said, I wish I had known. I would have made a difference. And there are other parents that say I still would have done the same thing. So, but at least you have the information. So number one is to know your status. Number two is practice good hydration on a daily basis, whether you have sickle cell trait or not. Practice good hydration, half your body weight in ounces. And if you think that your team, your city league, your youth league, your high school, your college really needs some reinforcements for education, then call us. You can reach us at the asonefoundation.org, all spelled out, asonefoundation.org. And we, within as much ability as we have, we will come and educate your club or your league or even your coaches or your administrators on what we're trying to do so that we can continue to save lives.
Amazing. This interview was so amazing.
It was. I feel like one thing that I really love about, our program and us doing this is I feel like every time we have somebody on, because they have that level of expertise, I always learn something. So
yeah.
Even being a pediatric nurse practitioner, I've learned so much. So we definitely appreciate you taking the time and speaking with us today.
Thank you, Dr. Tamia.
I am honored. I'm just so proud of you ladies for what you're doing. Your health is lit. I just think that's so amazing. I really do. And we need your voices. We need your voices. Old fogies like me, we're getting educated, but we need the young voices. I mean, one of the other big things is that our medical community, our young clinicians, our young physicians, nurse practitioners, physician's assistants need to know this, and they don't know it. And they don't know that they don't know. Right. So, it's just imperative that this is another set of information that maybe they didn't get in nursing school, maybe they didn't get in med school, but, they're going to deal with it one way or the other. So, we also have a sickle cell trait education symposium where we actually educate clinical career-seeking students to try to shift the paradigm toward this, maybe some hematologists will come out of this, maybe people will research it, because we got to hit it at all angles. We got to educate the clinicians, we have to educate the affected population, and we got to do it all with, a few resources, but we're still going to do it.
My question, I guess, for me is if on your guys' website, do you guys have teaching tools? So let's say I have a parent and their infant, has come back positive with the sickle cell trait. Can I go on the As One Foundation website and download a teaching tool or quick tips that maybe, even if I can't explain all of it, I can, disseminate to my parents?
Yes, and I mean, right on cue. I would thank you so much for reminding me. We have what we call the Sickle Cell Trait Parents Guide. It is the asonefoundation.org/SCT for Sickle Cell Trait Parents Guide. It's a free download. It has tips for parents. They can take it to your kid's practice. You can take it to your doctor or nurse, ask questions, and it also includes tips on what types of things to take, especially if you're a parent of a physically active child, because we don't discourage making them sit down. We absolutely, are not saying they can't play, but play and be armed with the best information possible. That's a free download. Obviously, they'll be linked to us as we do updates to that and add to our resources. But right now, that is a very popular resource that we have available.
So what we'll do is we'll download it, we'll post it in the group, and then we'll also make sure that we add you guys' website onto our health literacy resources.
Wonderful.
Just so that way, people have access to information. So we are just so grateful that, you took time. I know you're traveling and all of that to take time and kind of stop and talk to us. We really appreciate
Very busy lady.
Yeah.
Well, thank goodness for Starbucks. Thank goodness. I'm sitting in the Starbucks parking lot.
Oh.
Opportunity.
Thank you.
Thank you.